A new strain of the coronavirus in Britain has prompted Prime Minister Boris Johnson to impose a strict lockdown on London right before Christmas. So for more on the coronavirus, let's bring in Dr. Ron Elfenbein. He's a medical director and owner of First Call Medical Center. And Dr. Ron, I appreciate you taking the time out. Clearly, we can see you're in the middle of things, in case people wondered if you just played a doctor on TV. No, you're legit. So listen, let's get right into this new variant that I think is, making people a little nervous. We're hearing that it's supposedly more infectious, more contagious than the coronavirus that we are used to. What do we know about this, and how concerned should we be?
Well, good morning. So, there's definitely some degree of concern anytime there's it's not a new strain, it's just a mutation. Anytime that there's mutations, now there's bound to be mutations always with viruses. They're constantly mutating, some more than others. The coronaviruses in general tend to mutate quite a bit, and it seems that this one is mutating. Now, there's going to be mutations that hurt the virus and mutations that help the virus, and clearly due to natural selection, which everybody kind of learns about in high school science, the mutations that help the virus are going to be obviously selected for, and those are going to be more likely to appear. Now, this particular strain that you're talking about in the UK really, we don't know anything about it yet. We don't know much, how infectious it is, where it is. We haven't really been able to study it yet. It might just be that people are making a big hay out of nothing, or it might be that it, in fact, is much more infectious than the strain that we've been dealing with, for the last, 8 months, 9 months. We just don't know yet. So, people are asking, is the vaccine going to work against it? There's no data to suggest that the vaccine will not work against this new mutation. So I don't think people need to panic. I just think we need to let the science pan out and see what we know about it. It really is just a mutation. It's nothing to fear. It's a normal process. It is what happens with viruses.
That's good to know. I've seen splashy headlines that say 70%, more contagious. And then I've seen other headlines where, people in the medical community are saying just what you're saying, which is we have to see the data. We don't know enough about this variant yet. But I got to wonder, is there a likelihood that this could force changes in our social distancing guidelines? And also, you mentioned that the vaccine, that right now we don't have any evidence that the vaccine wouldn't work on this variant as well, right?
Correct. So as far as the vaccine, I want to just reiterate that to your viewers. That's a really important point. There is no data, no data at all. I want to emphasize that point to suggest that the vaccine will not be effective against this new mutation that has appeared in the UK. We don't even know how widespread that mutation is in the UK. It's entirely possible that there was just a super spreader event and somebody, got infected with a virus, with this virus. The mutation occurred naturally, and that mutation just happened to spread because that person was, went to choir practice or who knows what and spread it to 1,000 people. So we don't really know yet enough about it to really make any kind of worrisome or change any kind of our guidelines. And as far as the social distancing guidelines, masks and stuff stays the same. Nothing is changing. And again, this should not affect the vaccine. Very smart people, virologists are working on that to make sure of that. But there is no data to suggest that there is any problem with the vaccine, that it will not work, that it won't work against this particular mutation.
So we already know that the mutation, even though we keep talking about it coming out of the UK, it's actually in other places as well. I know South Africa is one country. I'm not sure about the others. But this has prompted, a number of countries to either place restrictions or halt altogether travel from the UK. That hasn't happened here in the US, but, we played some sound from the governor in New York, Governor Cuomo, and he basically said, hey, this mutation is probably already on the plane coming to this country. Based on what we know so far, the likelihood of this mutation popping up in the U.S., I would think it's pretty great if it's not already here.
Yes, I would think so too. And again, natural selection is what it is. So anything that helps something survive or thrive will be sort of promoted. Anything that helps it not survive or thrive will be kind of washed out. So if there is something that to this particular mutation that makes the virus more infectious or more easily spread or whatever, then it will most likely become, a dominant type of mutation that we're going to see more of. But again, we don't know that. We don't have any data to support that. I think we just kind of have to wait and see. Honestly, to some extent, there might be a little bit of fear mongering going on, and I think people are just kind of jumping on the bandwagon. That being said, obviously when something like this happens, you do want to isolate as quickly as you can for fears that there might be something going on. We just don't know. So it makes sense to kind of be careful and be extra cautious.
Yeah. We don't know what we don't know, but on the flip side too, you don't want to sort of get yourself into a frenzy over something that has been unproven thus far. All right, so let's get down to this vaccine. Pfizer vaccine is being distributed. The Moderna vaccine is being distributed. We're hearing from the CDC that frontline workers and people 75 and older should be getting the vaccine next. And then what about after that? Who else would be sort of in the next round? I'm thinking about maybe people in the food industry. We know that people in sort of the meat processing industry were really sort of hit very hard, but how do you foresee this going?
Well, I actually got my shot on Friday morning. I got my first vaccine, and I feel great. It's no problems. I have a little bit of soreness at the vaccine site. That's about it. I've had no problems. So yes, I think it's going to be frontline healthcare workers. Then it's going to be essential personnel. I believe firemen, police officers. As you said, meatpacking people that are necessary for the sort of infrastructure of this country to function, that have been hit very hard and that are essential workers. So I think that, and of course, you got to look at the elderly too, that they need to be protected. Now, in nursing homes, the elderly that aren't in nursing homes can, for the most part, can isolate at home and not have to go out. But obviously, they're at higher risk, so they should be vaccinated first. So I think you just have to look at the risk matrix and say, who's at the highest risk, and just go down the line and say, people who are around coronavirus people all the time, like myself, they should be vaccinated first. Then you kind of go, all right, well, at the hospital, for example, they're going to look down to, they have tiers 1, tier 1A, tier 1B, tier 1C, then tier 2, tier 3, tier 4 of the physicians and the nursing staff. So like, for example, a radiologist who's not around patients all the time doesn't necessarily need to be in the first round of people vaccinated. They're still in the hospital. They're still at higher risk than, say, somebody who's, working from home, but they're not at high risk as like myself or, the guy at the gas station who's interacting with hundreds of people every day. So, the guy at the gas station, I think, would probably be a pretty high person to get vaccinated. He'd be pretty high on the list because he's an essential worker. Those people that need to be there for our society to function, I think, need to get it. And then, of course, like I said, the people at highest risk, the elderly, those with diabetes, hypertension, and the risk factors that we know of that put them at higher risk for catching and dying of coronavirus.
Right. So lastly, of course, this is the Christmas week. We have been warned leading up to this week, being asked not to travel to see our loved ones as much as it's going to sort of really suck. A lot of people sacrificed during Thanksgiving, and, I'm sure they were hoping they wouldn't have to sacrifice during Christmas. But even though travel is down significantly, I think they said 60%, a ton of people are still traveling. The TSA said that they screened over 1 million people, I think, on December 18th and December 19th. That is the first time since the pandemic started that they have screened over 1 million people 2 consecutive days. So clearly, that's just people flying. So clearly a lot of people are traveling. Is it safe to assume that we're probably going to see another post-holiday spike in cases, a surge within a surge?
Yes, I think that's a very prescient prediction there. I think that you're absolutely right. We will see another surge in the next couple of weeks of people who catch it, who are traveling by air, by sea, by train, whatever. Over the next couple of weeks, we're going to start seeing those numbers skyrocket again, unfortunately. Yes.
And so the reminder to everyone that even if you didn't travel, that means, the next few weeks, there's a good likelihood that there's just going to be more of the virus around. So be extra vigilant when you go to the supermarket. Make sure you get that mask on. Make sure when you come back, you remember to wash your hands. Sometimes I think some of this stuff falls by the wayside a little bit because we've been just doing it for so long, Doctor. But, when everyone travels, that also means that even if you don't travel, you also have to be extra vigilant, I would think.
Yes, that's a great point, Emery. Thank you for making that. We've talked about this ad nauseum on the show, but you're absolutely right that wash your hands, stay away from other people as much as you possibly can. Stay home as much as you possibly can. Don't interact with others that aren't part of your immediate family as much as possible. Just be smart and be safe. And you're absolutely right because other people are traveling. That's going to put everyone else at higher risk because there's going to be more of the virus around. You're absolutely right. So please, please, please be extra vigilant. Even if you're staying home, you're absolutely right that, just there's going to be more of it around.
Dr. Ron Elfenbein, listen, I think you're at a testing center there. It looks like a shipping container, which I think is probably a testament to how quickly some of this stuff is being put together so everyone can get access to the medical help that they need. You please be safe, because we enjoy talking to you and we need you to keep coming on here at CBSN. Thanks a lot.
Thank you. Stay safe. Have a good holiday.